afternoon, everyone, and welcome to today's PHO webinar presentation, Spotlight on Vaping, Evidence on Dual Use of Tobacco and, Dual Use with Tobacco Cigarettes during this year's National Non-Smoking Week. My name is Selena Degano, and I'm a Senior Program Specialist here at Public Health Ontario, and I have the pleasure of moderating today's session today. Before we move forward with the presentation, we would first like to respectfully acknowledge that we are all participating today on traditional lands of many nations, which they have inhabited from the beginning. As settlers, we're grateful for the opportunity to live and meet here, and we thank all the generations of people who have taken care of this land for thousands of years. I would like to acknowledge that I'm participating today from Toronto, on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. Please join me in acknowledgement and respect of all Indigenous peoples, their life journeys, and worldviews. We would also like to respectfully acknowledge that any reference to tobacco in today's presentation refers to commercial use of tobacco, which is not associated with the sacred and traditional uses of tobacco, which Indigenous people have been using for thousands of years. Traditional or sacred tobacco differs from commercial tobacco, both in the way that it is harvested and the way that it is used in ceremony and prayer, and often for healing and purifying. So it is now my pleasure to introduce the speaker for today's presentation, Dr. Michael Chaiton. Dr. Chaiton is an independent scientist at the Centre for Addiction and Mental Health, Director of Research at the Ontario Tobacco Research Unit, and an Associate Professor at the Dalai Lama School of Public Health at the University of Toronto, where he teaches the course Tobacco and Health from Cells to Society, and is a co-director of the Collaborative Specialization in Addiction Studies. With a PhD in epidemiology and over 20 years of experience in tobacco control, his work focuses on evaluating policies for smoking cessation and understanding tobacco-related comorbidities. Thank you, Dr. Chaiton, for being with us today, and I will now pass it on to you to get started on your presentation.
Thank you so much, Selena. And it's a pleasure for me to be here today. When Selena and I were talking about some potential topics, I think this is one for me. I think that is a really interesting one and somewhat underexplored in terms of from the public health community side, looking at the impact of dual use of e-cigarettes and with tobacco cigarettes. And I think this issue has a whole range of ways of approaching it and different sets of implications. And so I'll be covering some of those today, some of them somewhat superficially. So the learning objectives of this presentation are to understand the health impacts of dual use of vaping products and tobacco cigarettes. 2, to understand the role that vaping plays in the harm reduction of tobacco use. 3, describe the impact of regulations on use and the relationship between vaping products and tobacco sales. And 3, identify vaping tools and resources available to those working on tobacco and vaping. So e-cigarettes are a controversial issue. And they're controversial because of one, it's that there's these new tobacco product that has emerged that is reaching a whole new generation of people who may not otherwise have been exposed to nicotine. However, there was also another side of e-cigarettes, that a promise that these were products that were healthier than cigarettes, and that switching to the vaping products was a way of being able to reduce the overall public health burden associated with tobacco. This idea didn't actually come from the public health community, and it has been actually long thought of from the tobacco industry. This is an image from an event that Imperial Tobacco Canada held in Montreal. It was part of a big project to look at the impact of, or try to look at potential um, alternative products and ways of trying to make a safer cigarette that involved both like they you tried to look at the chemistry of it. But eventually it became less of a product development thing and more of a marketing issue. And so what the marketing people thought is, wouldn't it be great if they had a product we called here Vision. And if you look down there, it's this new vision. We took away the tar, the carbon monoxide, and the smoke, but left all the enjoyment. And this sort of hypothetical product is one that kept the psychoactive effects of nicotine, that kept people addicted, that will allow them to continue to sell products in the face of sort of public health pressure in about the concerns of the health effects of cigarettes. Um, but and in fact would not have the health consequences of those cigarettes. And what's true about this idea, and what the actual product that kind of emerged from this vision, is that the vast amount of harm from cigarette is attributed to the smoke or the tar or the carbon monoxide, and it's not the nicotine. Nicotine does have some health effects, but the vast amount of that were attributable to smoking is associated with the sort of the burning of organic matter and the thousands of chemicals that are created from that burning process. E-cigarettes don't have most of those. There are some chemicals in the product. There are some sort of other chemicals that are associated with the heating process. But fundamentally, it is a much more simpler thing with most of the harmful chemical elements removed. It does continue to have nicotine, which is the drug that is the chemical responsible for addiction and for the psychoactive effects that are associated with cigarettes. The idea here, though, with e-cigarettes is that you want people to switch. And the issue in Canada is that we may not be reaching the right audiences, that most people or many people in Canada who are using e-cigarettes are either current smokers, that is dual users, or never smokers at all. So among Canadians who are aged 15 years and older who currently vaped in the past 30 days, 33.5% also reported current smoking. So about a third of people who are regular vapers are also regular smokers. So these are sort of true dual users. It's about 600,000 people in Canada who belong to this group. Of those who reported current and former smoking, most adults, that is, we're defining adults here as those aged 25 years and above, who reported past 30-day smokers, were at some point current smokers. So these are people who are either dual users or may have been dual users in the past. On the other hand, we look at a very different population of youth aged 15 to 19 years old, and we see almost the flip of that effect. That most people, the majority, 2/3 of youth who reported past 30-day vaping have never smoked a cigarette in their lives. So that these are not, generally youth are not dual users in general. There are certainly a percentage of them, and it is a substantial number, that 5.3% of students in grades 7 to 12 reported use of both cigarettes and vaping devices in the past year. So these are not necessarily people who are vaping and smoking regularly, but just had past year experience with both. And that number rises significantly as you go through high school. So rates of in grade 12 are around about 10% of students had at least tried both a vaping device and a cigarette in the past year. The key issue with cigarettes and sort of the promise of them is that they are less harmful than e-cigarettes. But we also are very conscious of the fact that e-cigarettes may have their own harm associated with them. And we've spent over 60, 70 years looking carefully at the impact of tobacco cigarette, of smoked cigarettes. And we are still learning about the impacts of cigarettes. And it did take probably about 30 years of intensive scientific research before there was a significant consensus on at least some of those harms. Most notably, lung cancer was really the first outcome to be truly associated with cigarettes. So we haven't had that kind of time to really look into the harms of e-cigarettes. But we've certainly started the process of studying. And last year, CAMH, led by the Intrepid Lab and Peter Selby, along with the Ontario Tobacco Research Unit, embarked on a project called Project Vector, funded by Health Canada, which looked to identify some of the harms associated with these cigarettes, what was actually out there in the literature. You can see the link there, and I think it'll be in the notes to see more of there are a number of different products associated with this, and you can look more carefully at the guidance. But what we did is we conducted a systematic literature review of all the literature, brought together hundreds and hundreds of different papers on a variety of different outcomes associated with harms associated with e-cigarettes. And then we took those harms and we brought it to an international expert panel with scientists from across the world, from the UK, from the US, and from Canada, and asked them for their recommendations of, given what we know now, what is the strength of the evidence that we have? And what would be the recommendations we should make to people using e-cigarettes? So in general, we found a couple of things. One, the level of evidence for e-cigarettes is still emerging, and that there is a lot that we don't know. But the ability of the expert panel to make clear recommendations that they felt very strongly that even with the limited amount of evidence, that we do have some recommendations that we can make. So for people who are not cigarette smokers, these are primarily youth and of course older adults who have not cigarette smoking, then the evidence is sufficient to demonstrate that you should not use e-cigarettes. That this is an easy piece, even given the level of evidence that we know. That the effects of cancer are do not use, cardiovascular risks, dependence, and respiratory health. Similarly, for people who are current e-cigarette users, who are not dual users, that is, they're not also using cigarettes, and they're not concerned about their relapse to cigarettes, or they were never cigarette users in the first place, then the evidence is also clear. Avoid long-term use of e-cigarettes. That is, if you're currently using e-cigarettes and there's no risk of relapse of cigarettes, then there is sufficient evidence to say that you should quit vaping. And the final set of recommendation is a slightly different version. So we've got two sets of don't use e-cigarettes. Don't use e-cigarettes if you don't smoke. Don't use e-cigarettes for a long time. Stop as soon as stop when you can. But the third set of recommendations from this expert panel was that that if you are a cigarette smoker trying to quit, and that you are dual users and you haven't been successful with other methods, then the evidence here is also clear that you should switch to e-cigarettes to reduce risk. That is, from a health perspective, the evidence suggests that switching completely, and that's important, to e-cigarettes is a way, even given the information that we know, of a way of being able to reduce the risk associated with cigarette smoking. Now, for all of these, and I do encourage you to go to the actual reports and recommendations, I've sort of made it simplified the recommendations, but I think it's a sort of important to go into some of those qualifications, both to sort of understand what we know and what we don't know and how confident we might be in them. So for instance, that for our cancer evidence, it's important to sort of know that there is actually really no evidence currently that e-cigarettes are associated with cancer. There haven't been any studies that have shown that e-cigarettes are actually associated with cancer. However, there is good evidence that e-cigarettes are associated with exposure to cancer-causing chemicals. And the expert panel had high to moderate confidence in this. So it's one of that we're very clear that when you use e-cigarettes, there are cancer-causing substances in them. And that is more likely may lead to a risk of cancer when we actually have those studies available, which may take 20 or 30 years to really truly get that sense of what that evidence is. The second sort of proviso is around the evidence of cardiovascular studies. And here again, we have quite limited evidence directly associating cardiovascular deaths or mortality or morbidity associated with the use of e-cigarettes. What we do have is really good evidence suggesting that using e-cigarettes is associated with exposure to some cardiovascular toxins. However, what we know both about the cardiovascular side of it and the cancer side of it is that that exposure, the magnitude still unknown, to those chemicals is substantially lower than that associated with cigarettes. That is, if you switch completely, you are able to reduce your exposure to those chemicals in a way that the expert panel thought was indicative of improving health. Similarly, respiratory health had a similar recommendation where users with pre-existing conditions should switch completely for better lung health. Now, for both respiratory health and cardiovascular health, there are actually important sub-recommendations, particularly the concerns around providing e-cigarettes to people who just had cardiovascular events like a myocardial infarction, where there is good evidence that e-cigarettes have impact on some elements of cardiovascular health. For instance, they increase your blood pressure, increase your heart rate. And for respiratory health, there's some evidence suggesting people with asthma might be exacerbated by using e-cigarettes. And finally, there was on dependence, that switching completely, the dependence was important actually, because being addicted to e-cigarettes allows you to switch from cigarettes. It's an important part of it is a part of the process. And to remaining smoke-free. And the panel had sort of high to moderate confidence in that. On the other hand, there was significant debate about whether or not e-cigarettes were indeed less addictive in sort of in an absolute sense than e-cigarettes. And some of the panel felt that e-cigarettes were inherently less addictive than cigarettes. And some of the panel felt that no, they could be just as addictive as cigarettes. And so this was sort of the one recommendation where the panel could not come to make a strong recommendation. Every single other factor, despite sort of the uncertainty of the evidence, they were able to make a strong recommendation, except on this one point. So given what we know about health, And I sort of want to emphasize how little we sort of know about the absolute magnitude of the risk. We know that there is some reduction in risk, but we still don't yet, and we may not for a long time, know what that absolute impact is. In a study that we conducted with a group from the University of Melbourne, we ran a simulation study looking at the impact of our current e-cigarette policies and how effective they were and what the overall benefit was or cost to health associated with those policies. And what we found is that that overall health impact, whether or not cigarettes were causing harm overall or causing or were in fact beneficial for health, really depends on what that absolute risk to health ends up being. That we sort of drew the line essentially, like given our current situation, if e-cigarettes are about a third of the risk associated with cigarettes, then we're likely it's a sort of a neutral impact. It does seem that there's a strong potential that in fact the risks of e-cigarettes are less than that maybe more than 5%, but perhaps 10 or 20% the risks of cigarettes, in which case even our current sort of flawed policies around e-cigarettes may be suggesting that e-cigarettes themselves may be overall beneficial when in terms of their impact on public health and relative to the cigarettes. So this was one of the things that makes e-cigarettes such an interesting public health problem. What we have here is a balance of recommendations, not just what are recommendations that are associated with cigarettes, which are don't use cigarettes, but two sets of opposing calls. One which suggests that you shouldn't use, for their populations in which you shouldn't use e-cigarettes, people who don't smoke and those who are only using e-cigarettes and not at risk of smoking cigarettes. That the recommendations here are strong and clear, that those people should not use e-cigarettes. On the other hand, there is a group and a population at significant size in which the recommendation for maximizing public health is actually to get them to switch completely to e-cigarettes. Not necessarily, maybe, and eventually to stop. But the initial recommendation is to have them use this product that for most people we're telling not to use at all. This is a pretty nuanced idea, and I think really a challenging one, both to communicate from a public health perspective, and to it's something that I struggle with actually trying to interpret as well. But this balance suggests that in order to sort of maximize public health, there should be populations in which we're trying to encourage people to use e-cigarettes. Those people who have had troubles trying to quit and have used other resources, which are most people who smoke at the moment, or those who and to get people not to use those who are not current e-cigarette or cigarette users. Even beyond this, there are particular guidelines that we can get to reduce the impact further. The more that we adjust this balance, minimizing the harms associated with use of e-cigarettes by those who use them, minimizing the number of people who are using e-cigarettes who shouldn't be using them, and maximizing the e-cigarette use among people who would benefit from it. And this slide suggests a number of different guidelines associated with the CAMH lower risk e-cigarette use guidelines. And these are the ones that I think are particularly applicable for dual users. from the idea of use of nicotine replacement therapy and nicotine replacement products to try and help quit or limit exposure, from the idea that dual use is not helpful at all, and there's no evidence to suggest this, that if if you haven't switched completely. That is, dual users who are not who are continuing to use cigarettes are not gaining the health benefits that are associated with not gaining the health benefits. Just no evidence to suggest that reducing it a little bit will actually have any sort of significant impacts. And so the real recommendation is to quit smoking, even if you're using e-cigarettes, to do that. There are also recommendations about cutting back on the nicotine use, how much you use e-cigarettes, and minimizing your nicotine exposure. The next question for this balance is, have had e-cigarettes on the market for a number of different years now. And if this, there are simulation studies and these expert panels, it's like, what in the real world, is it actually having this effect? Are cigarette sales, the presence of them, actually impacting e-cigarette users? And that presence of both in the market and the large number of dual users, is it having an impact on the way that cigarettes are used by people in Canada? And there have been a number of different studies, and there are about looking at this association from prevalence of both, looking at these over time. There are a set of cohort studies, which we can talk about later, but which is sort of a different modality. I'm really interested in more so about looking at how the use affects use, and how that affects prevalence overall. And the challenge, though, for all of these studies is that we have these known trends, that we've seen declines in cigarette use that since about the mid-60s, that apart from a blip in the 90s when we took away taxes, we've seen almost a very long-term decline in cigarette use. And e-cigarettes are a new product that have emerged in popularity. So over the same period that e-cigarettes have existed, we've seen an increase in their use broadly. So we have these two trends, one that's going down long-term, predating cigarettes, the other that's going up, and that, it's sort of inherently going up because it started from zero. And so any study that looks at these two trends and puts them together runs into a fundamental issue, that this is the classic correlation does not equal causation. You've got one trend going up and one trend going down. When you do the math, it looks like they're associated with it, but you can never be sure that this trend isn't just a total coincidence. The other sort of important element, I think, in terms of all of this is actually in David Hammond's work at the University of Waterloo. And what his point, and I think it's a really important one to recognize, is that what you see in the substitution effect primarily when you look at these trends is like, yes, you have this association between e-cigarette sales or e-cigarette use and cigarette use. But what you really see a displacement of is NRT products, that e-cigarettes may have just been replacing nicotine replacement products rather than actually impacting cigarette sales on their own. with the help of Health Canada, in particular, I'd like to acknowledge Rob Nugent and Chris Houston, who are in charge of looking at sales data from cigarettes and have and provide us as access to Nielsen IQ data on sales of e-cigarette use. And we took the data that was reported to them or collected by Nielsen, and we took a slightly different approach to trying to understand the relationship between e-cigarettes and cigarettes. And it's called the Granger causality, which uses something called a vector autoregressive model. And the reason why it's different is what it uses is the not the long-term trends, which are in sort of inherently problematic, but actually the short-term changes, the month-to-month changes between cigarette use, between cigarette sales and e-cigarette sales. Because what we find with both of these products is there actually substantial variation for any given month. If cigarette sales go up and down wildly, they actually fluctuate dramatically through the year. Sales of cigarettes in January are just a fraction of what you see of cigarettes in June. And so what those means is there's like a lot of sort of, there's some overall sort of seasonality trends, but also just a lot of random changes. And so we can take advantage of those random changes and look at the differences to say, if something are actually causally related, then even that random change should lead to a change in the sales of the other product. So if e-cigarettes were actually having an impact replacing cigarette use in the population, these random fluctuations in e-cigarette sales should lead to a change in cigarettes. On the other hand, if e-cigarettes were really causing more smoking to occur, we should see the other direction occur, right? That as sort of the random fluctuation in e-cigarettes should be associated with, at some point, at some lag, an increase in cigarette sales. And what we found is that in fact e-cigarette changes did predict a decrease in cigarette changes overall from across Canada and in most provinces. There are some differences for both BC and Quebec, but generally we saw this association, which month-to-month changes in e-cigarettes are associated with decreases of sales of cigarettes at a lag, which have varied actually between provinces. On the other side, month-to-month changes in cigarettes are not associated with e-cigarette sales. So the studies that have been done previously looking at those associations and trends would have a difficulty identifying that direction of effect. But by looking at really short-term changes, we can see which changes are driving it. And together, at least our interpretation, is that there certainly are other possibilities and other limitations to this data, but it's sort of a set of evidence that suggests that in fact e-cigarettes are in fact substituting for cigarettes on at least at least some level, and may or may not be just doing it from a dual use perspective, or maybe also associated with changes in quitting too. That study looks at sort of the broader trends, but we're also, you've probably heard of other studies that look at the other side of the relationship. Are e-cigarettes, are they increasing smoking? And there are literature reviews and cohort studies that have certainly found that e-cigarettes are associated with an increased likelihood of smoking among, in particular, youth. We've also run a study on this using the vaping dependence cohort out of the Ontario Tobacco Research Unit. And we're looking about whether, like, so this idea that that in the sales data, there's a suggestion that having e-cigarettes available is associated with changes in smoking. And can we actually see that sort of when we actually look at real people? So the vaping dependence cohort is a study of Canadians aged 16 to 25 when we recruited them in 2020, and we followed them. We followed them every 3 months for up to 21 months with a 76% follow-up rate average. This study looks at a population of about 1,000 past 30-day cigarette smokers, with a good percentage of those who are concurrent e-cigarette users. The percentage is high because we oversampled for e-cigarette users. We use a survival analysis looking at whether or not people quit smoking. And ran a number of sensitivity analysis, particularly of asking if their main reason for smoking was main reason for vaping was in fact to quit smoking. And what we found is that overall is that there were that e-cigarette users were actually less likely to quit smoking than cigarette users in this population. If they use so people people were less likely to quit smoking if they were also current e-cigarette users that existed before and after adjustment. This was not true among those who were quitting for vaping versus other reasons, but there's still no. It didn't appear to be a successful impact of e-cigarette use on successful smoking cessation. However, we looked a little deeper of the data. And what we found is that this was a young cohort. And so there are different groups. There were people who were regular users, but probably have cigarettes, but probably hadn't been smoking for that much time. And there were those who were a little bit older in their 20s who may have been smoking for 5, 8 years, 10 years. And those populations we found to be very different. And the impact of vaping in those populations had an enormous impact on whether or not e-cigarettes were helping them or not. So fundamentally, that people who were smoking few cigarettes, these are the 2 lines at the bottom. So these are people who are smoking less than 5 cigarettes per day. And what we saw is that the further down you go, the more successful people are at quitting smoking. And that the fact that people who don't smoke as much are more easily quit is not a surprise. And among that population, if you're vaping and not smoking very much, it is those people vaping hurt their chances of quitting smoking. On the other hand, if you're a more established smoker and you're vaping as well, those people in this population study, not people trying to quit, just sort of look at what happens to them over time. Those people, and this is the yellow group here, found that vaping was substantially associated with successful smoking cessation. That people who vaped after they had started smoking, when they were already established smokers, were more likely to quit. So what that means, essentially, these are more numbers, but I think I'm going to not go through it. You could read the details here, but sort of fundamentally, if you're vaping and you're an emerging cigarette smoker, what's likely happening is you're developing that vaping process helps you become more helps you become a cigarette smoker. In the same way that we've seen those other cohort studies associated, see that people who vape are more likely to smoke, that there's a true effect that among emerging cigarette smokers, that using vapes at that time probably helps you become more addicted and helps you makes you more likely to continue smoking. On the other side of it, those who are already established cigarette users who are smoking more regularly, we see that who are even more addicted to e-cigarettes, that the more addicted they are, the more the more cigarettes that they smoke, the more helpful e-cigarettes were in the cessation process. So we have another case where two things are true. In one case, e-cigarettes were helping people quit smoking. In another case, in a different population, we saw that e-cigarettes were helping people continue smoking. And the balance of that population of who we reached gave an impact, could have been either positive or negative, depending on what the balance of frequencies of those populations were. So that in this case, in this study, because we saw more people who were harmed by cigarettes, the overall impact was negative. In a different population, we might have seen a positive overall impact. That youth and young adults are very different life stages, and in particularly compared to older adults. And that e-cigarette use predicts greater difficulty in quitting among those who may still be developing nicotine dependence. And the more frequent use of e-cigarettes predicts greater difficulty. But the reverse is true among more established smokers. So fundamentally then, the e-cigarette debate is about trying to thread a needle, where it's a nuanced association between cigarettes and e-cigarettes. We still have a substantial amount that we need to learn about the actual impacts of the health effects of e-cigarettes and the absolute magnitude of that health effects, so, a number that we may never know, but certainly won't have a good handle on for decades. It sort of determines the cost benefits at a population level. However, we can still impact those costs and benefits now. We have a clear sense of which populations we can identify where e-cigarette use can be harmful, where we want to discourage discourage long-term use of e-cigarettes, and encourage people who had trouble quitting in other ways to use cigarettes. And that we do have some evidence to suggest that the presence of e-cigarettes in the market in the way they're currently used is associated with some level of switching. These, the expert panel suggested, are strong recommendations that do, in fact, vary by population. And we, I think, have the ability to balance the costs and benefits with their choice and policies. That we may not know the impact of the health impact of e-cigarettes right now. But if we can target policies that help that reduce the effect or the use of e-cigarettes by youth and increase e-cigarette use in the populations that would benefit from it, that whatever that absolute number of harm ends up being, we know that we have sort of maximized our policies. And I mean, to be fair, we've done a really good job at the opposite. That we've done a really good job at getting youth who haven't smoked to start to use e-cigarettes, and we haven't done a good job about getting adults who are using e-cigarettes to use them or using cigarettes to help them quit. One potential policy option that might have in fact been threading this needle is our restriction on flavors. And we assessed the impact of flavor restrictions across Canada in the vaping dependence cohort that we talked about earlier. And there were a variety of different flavor bans and regulations in place that varied by provinces. And when we took a look at that and looked at the impact on use over time, what we found was that uh, um, the implementation of flavor regulations, and this includes both regulations like we have in Ontario, which where we limit most of the flavors to only sales in 18 over stores, as well as provinces that have banned flavors entirely. We group those together. But both sets of regulations showed among this cohort a decrease in vaping prevalence. That is, people who overall that we saw the vaping prevalence reduce over time associated with this introduction of vaping regulations. We weren't able to identify, we saw some small impact both on cessation and on initiation, neither of which were statistically significant on their own, but together that we're able to show an impact. And importantly, um, and importantly, what we also saw from this data is that the impact, the implementation of flavor regulation was not associated with an increase in smoking. So there have been some of the vaping advocates say that if you put in flavor regulations, we're going to see more smoking, but that's not true from a youth and young adult perspective. That flavor regulations may be one of these pieces where we have been threading the needle successfully. We're aimed at the people who are using e-cigarettes who for casual recreational purposes are no longer as interested in using it. For people who want to use it because of health reasons, still may be interested. So finally, I want to talk a little bit about helping people who are currently using e-cigarettes and not at risk of relapse of cigarettes, of helping them quit vaping. And there are certainly a number of excellent programs and services that are out, and a number that are in the process of being developing. One, I think, I hope you've heard about this, is the really excellent QUASH program and set of services developed by the Lung Health Foundation. This is a really sort of it's a great app and program. They have ones associated with where you with school-based programs as well that use this and the URL is there for to access this, and I think this is probably one of the most streamlined services available. We have also developed our own program, and we have been imminently about to release it for a very long time now. There's still a few sort of technical challenges of the second version, which will has a French translation and a sort of machine learning analysis that develops sort of targeted quitting programs for each person who uses it. We've done some studies on this that show some impact on youth, and this is available both in it will be soon available in the Android store and is available in the iOS. And finally, I also wanted to point you towards CAMH's vaping cessation guiding resources. These resources and the guidance are excellent and in-depth, evidence-based as much as possible, guidance for people who are directly involved in helping people quit vaping. And sort of strongly recommend you take a look at both this resources and the others available in the Intrepid Lab for help in the sort of the process of guiding vaping cessation for especially practitioners. The Intrepid Lab is also has developing other programs and I would keep an eye out for future developments at CAMH. So thank you very much, and if there are any questions, I'd happy to be address them.
Great. Thanks so much, Michael, for that amazing presentation. So we're going to move over to the Q&A segment to answer any questions from our audience. And before we get started, I just want to say there was a number of specific questions around vaping cessation. And as Michael had said on the last slide, and I also put it into the chat, Intrepid Labs has a lot of great resources that have like specific guidance around vaping cessation and supporting individuals who wish to quit vaping. So a number of those questions I think would be answered by the resources and tools and information there. So Michael, I'm just going to go to the Q&A, and one of the questions that has come up, so going back to the health impacts, is those that are dual users, so vape and smoke cigarettes, do they have any unique health impacts that, say, those that are exclusively smoking tobacco cigarettes or exclusively vaping don't experience? I think there was some, at least in the comment, that there was potentially some evidence that they have unique health impacts that others do not.
I think there's real a debate about this, and sort of fundamentally it goes into what is the impact of vaping on your cigarette smoking, and there's this sort of Stan Glance's work, for instance, has suggested that it isn't necessarily the case that vaping reduces your overall exposure to cigarettes if you're dual users. So that if you're smoking cigarettes and you're just adding e-cigarettes on, then you're just adding exposures to other things on. And so yes, you're having an impact of on a negative association for health. But it really depends on what that is. We've done a couple of studies in that cohort on respiratory health and sort of how it interacts with cigarette smoking. And in our cross-sectional study, we found that there was a benefit essentially to dual use. Sort of overall, those people who had vaping more were better off. When we looked at it longitudinally, though, you could tell that if you were actually just increasing your e-cigarette exposure and not decreasing your cigarette exposure, it was just adding on impacts. So there was nothing inherent about using cigarettes that it is a risk of itself, it is harmful of itself. It may, among some people, reduce exposure, but not everybody. And that's really the fundamental issue with dual use, is that it might be just increasing exposure for some people in those populations.
So do we have a sense from the evidence or any of the research that you've done of why people are dual using, or like the purpose or intent behind their use? Like, do we know like a proportion are using it to quit? Are they using it to maybe deal with, like, I guess, so where they can't already smoke, or they don't want to, maybe during work hours they vape so they don't smell like cigarette smoke, or that sort of thing? Do we have like sort of a profile or understanding of who dual users are?
I think they're a really heterogeneous group.
Okay.
That there are certainly people who are using them to quit. There are certainly people who are just adding on, that it's an additional recreational substance. There are people who are substituting some periods of time. I think the other important thing for dual use and sort of the process of quitting is that it's hard to switch. That is a difficult process, and the way that the addiction works in each substance or each mode of delivery is different, and so that can be challenging, and some people address it in different ways. And again, some people are just using it sort of as an additional recreational product, or to avoid using it in some places where it's easier, which again doesn't have the same benefits as switching completely.
For sure. So another question that's come up is around nicotine-free vapes and the use of those. Do we have any understanding about either their role in cessation, or is do the studies differentiate, or is predominantly individuals using nicotine, or is that the vast majority that have been studied?
Yeah, so I'm very suspicious of both people who report nicotine-free use. Like I think the people who choose nicotine-free use and actually have products that don't have nicotine in it, those are two different things. There are many products that say they don't have nicotine, but do, particularly historically. And I mean, from a theoretical perspective, the reason why vaping works is that you become addicted to the vape instead of being addicted to the cigarette. That's the theoretical mechanism of how you use. And the idea is that you're then not quite as addicted to the vape and so to the e-cigarettes, and so then it's easier for you to then quit that. And so it's a step process. But without a nicotine, that theoretical way just doesn't work. So nicotine free might be beneficial, particularly for those who are quitting vaping, and might be beneficial for some people, but from them that's not the mechanism of how at least it's supposed to work.
Okay, thank you. So we're going to probably have time for about one more. But you mentioned this in the presentation around like the balance of recommendations and how it's very nuanced. And we have some evidence now to show that we can clearly target specific groups where we could see positive impact. But as you sort of mentioned as well, and I think a lot of us are struggling, is do you have any recommendations on how to kind of help individuals, either public health and or the community, to better understand sort of like these nuances instead of just going for that discouraging vaping use completely, like the more black and white, where a lot of this evidence obviously is more nuanced and gray. Do you have any recommendations, or do we have any examples, potentially even from other substances and or jurisdictions that have maybe tackled this a little bit better?
I wish I had a better answer.
No
I mean, I
problem.
think the fundamental question is that it's the cigarettes that are the problem, and it's like there are health effects associated with vaping, but sort of fundamentally the burden is associated with cigarette smoking, and there's still millions of cigarette smokers in Canada. I think this question around is going to come up even more. The FDA put out recommendations for reduced nicotine cigarette. That means that it started the process of planning, which is going to take a long time, but they started a process of planning, putting in a rule saying that they're going to take the nicotine out of cigarettes. And the mechanism behind it, the logic behind the reason why the U.S. thinks that they're able to do it is that the plan is to switch people to vaping. And it's so this question around that balance and about the harms of nicotine versus the harms of cigarettes is going to come up more and more. And so but the focus, I think, should make sure that we're understanding that the problem has always been the cigarette. And that is what we need to make sure that is that we address.
Great. Thank you so much, Michael. Thanks again for an amazing presentation. And I would like to thank everyone who joined us for our event today. And lastly, I just wanted to send a reminder to everyone to save the date for topic, the Ontario Public Health Convention, which will be held on March 26th and April 2nd. And you can go to our website for additional details. So thank you all again for attending today. And thank you, Michael, for a great presentation. And I wish you all a wonderful rest of your day.